All
right.
Everybody's here. All righty.
Okay.
Is that David?
No, that wasn't me.
Just a little humor. Okay.
Wasn't me.
Okay.
All right, let's get rolling. We want to welcome everyone. The Stovall Foundation is pleased to bring you the post-pandemic perseverance. And now your host, Dr. Lance Williams, president of the Stovall Foundation. Dr. Williams.
Good morning, everyone. Thank you for taking time out of your busy schedules to be with us. Today's Zoomcast is the first in a series of public information and education forums that the Foundation will present. These forums are designed to discuss important issues of timely and crucial interest to you. 3 months ago, when we were developing this particular forum, the pandemic was a no-brainer, top-of-mind topic. The progress of abating the pandemic was well underway, but with current developments of the Delta variant and its impact notably on non-vaccinated and non-mask wearing people, our forum is even more important. Today, the LA Times, even today, Saturday, today, the LA Times reported that 97% of the Delta cases are with non-vaccinated, non-masked people. So they are a threat to us. Our panel features some of the most informed and enlightened experts who've been active on the front lines of fighting COVID. Others are very knowledgeable about the impact of the last 18 months on people's mental health and well-being. And we will discuss recommended next steps that must be undertaken to bring our community's economy all the way back so that no one is left behind. So before we begin the conversation, a few brief words about the Stovall Foundation. Stovall was founded as a continuation of the life's work of Dr. Leonard Stovall, a pioneering, innovative medical doctor, the first African-American physician hired by Los Angeles County General more than 100 years ago. The time was the post-World War I era when an earlier pandemic, tuberculosis, became increasingly widespread. At that time, there were very few tuberculosis sanitariums willing to treat African-Americans and other peoples of color. So in 1933, Dr. Stovall founded an organization called the Outdoor Life and Health Association on land in Duarte in the San Gabriel Valley that he and his wife, Yolande, donated. Many churches, organizations, and individuals contributed to this work. The demonstration rest home was dedicated in July 1940. Dr. Stovall and his team arrested some 500 cases of tuberculosis, and by 1954, the disease had largely been eradicated in this country. Dr. Stovall and his board of directors changed the organization's mission, closed the sanitarium, and they opened a home for the aged with the help of the City of Hope and Broadway Federal Savings and Loan. The association acquired land in unincorporated East Los Angeles and began construction of the home for the aged. Sadly, 5 months prior to the home's opening, Dr. Stovall passed away on February 18th, 1956, and the foundation has carried his name and legacy ever since. So, ladies and gentlemen, here's today's agenda. First, you'll hear a brief welcome by Hope Crawford, president of Top Ladies of Distinction, today's event partner, followed by panelist introductions. Moderators David Crippens and Khalif Dantzler will then ask a series of questions of our panel. Our moderators will be assisted by two outstanding young people mentored by Top Ladies of Distinction. So now, ladies and gentlemen, I'd like to introduce Hope Crawford, the newly elected president of the Inglewood chapter of Top Ladies of Distinction, for a few words. Hope?
Morning. It is indeed my honor and great privilege to welcome you this morning on behalf of the Inglewood chapter of Top Ladies of Distinction Incorporated and Top Teens of America. As you know, this is the first of many Zoomcast series for the Stovall Foundation. As we prepare to be informed and educated on the critical issues regarding the pandemic and its impact on the community, economy, mental health, and well-being, I welcome you to join in the great discussion on the recommended next steps to help bring back our community. Just a brief information regarding Top Ladies of Distinction. It was chartered in the state of Texas in 1964 as a nonprofit educational humanitarian organization. In 1964, while serving as First Lady at Texas College in Tyler, Texas, Mrs. Willie Lee Glass was the recipient of a luncheon invitation from Miss Lyndon B. Johnson, the First Lady of the United States of America, and also a fellow Texian. Miss Glass, with her wisdom, summoned a former student at Texas College graduate as a major in the United States of Air Force to represent her at this power luncheon. Mrs. Odell, a resident of Washington, D.C., answered the call to represent one of the mentors, and she was among multidisciplinary bevy of outstanding women from all over the world. At that time, she was so enthused regarding what she had learned at the luncheon, she decided to establish Top Teens of America and Top Ladies of Distinction. And that brings us today as a partner with the Stovall Foundation. And we're looking forward to this partnership. Welcome, and please join us in the discussion today. Thank you.
Thank you, Hope, for those wonderful words. We wish you and the Top Ladies continued success. Khalif and I will now introduce each panel member. Khalif?
Thank you, David. First, I'd like to introduce Dr. Denise Shervington. She is the chair of psychiatry at Charles R. Drew University. She previously held clinical professorships in the departments of psychiatry at Columbia University and Tulane University. She is a graduate of New York University School of Medicine and a fellow of the American Psychiatry Association. In 2018, she received the award for excellence in service and advocacy, prior to which she received the Jean Spurlock Minority Award. Next, we have Dr. Roberto Vargas, who is Assistant Dean for Health Policy and Interprofessional Education within the College of Medicine and Director of the Health Policy Pillar of the Urban Health Institute at Charles R. Drew University. Dr. Vargas is leading university-wide efforts in health policy analysis and health services research. He was recognized as CDU's Outstanding Professor of the Year at this year's commencement. Celia Valdez has been working in health outreach for over 25 years as the Outreach and Education Director with the organization Maternal and Child Health Access, located downtown. She has worked diligently with local and state government groups, ranging from community-based organizations to government agencies to improve access to free and low-cost health insurance programs. David?
Jai Phillips directs the Ready to Rise initiative as part of the California Community Foundation's public-private partnership with the Los Angeles County Probation Department. Additionally, he manages CCF's Youth Development, Juvenile Justice, and Boys and Men of Color portfolio to advance the foundation's overarching vision of providing youth and families with culturally responsive, asset-based, high-quality resources. And now we have Dr. Rosemary Venegas, who has 25 years of experience in health promotion. She currently serves as Senior Program Officer for Health at the California Community Foundation. She is also the chair of the LA County Commission on Hospitals and Healthcare Delivery, as well as co-chair of the LA COVID-19 Vaccine Work Group, Aligning Resources Committee. We now welcome your comments and appreciate your comments and ideas through this event. Please use the chat function to make comments. We will respond during the final section, and we will also have a poll in the chat below to help us to become aware of how we can better present these events. Now let's go to the questions. Khalif?
We know that California continues to struggle with diminishing numbers of people getting vaccinated. When the vaccine first became available, there was a huge rush. What happened?
Who would like to answer that? Rosemary? Rose?
Thank you very much to our host today, the top ladies of distinction and the Stovall Foundation. I'm Rose Venegas with the California Community Foundation. Early on, when the vaccine was available, those who had access to health insurance, as well as were technology savvy, able to use their smartphones or had an internet connection that was steady and strong, and also had the ability to take large time out from their day, were able to access the vaccine through the available access points at the time, which often were posted through the myturncalifornia.gov website. And so the rush occurred amongst those who had resources, who had time, health insurance, and the ability to navigate some of the technology barriers that were placed in the way of folks who needed the vaccine. And so typically that ended up being folks who were not from communities of color and were able to get to other sites where there was access to vaccines. And we saw after that initial rush that as it became harder and harder to get access because the websites continued to be flooded and inaccessible, individuals who really needed the vaccine were not able to access that, including many of the communities in the South LA and Southeast LA regions, and certainly in the North County Antelope Valley regions. I had the pleasure and honor of working with Dr. Roberta Vargas, who has co-led the Ensuring Equity Committee with the Vaccine Committee, and I know can provide a much more broad description of what he saw happening, both as a physician, as a community leader, and also as co-lead of the Ensuring Equity Committee.
Thank you, Rose. Can you guys hear me okay now? I think I was on mute.
Yes.
Great. Yeah. So, yeah, and I want to reiterate some of the earlier points that Dr. Venegas brought up, because this aspect of the early rush probably has some downstream effects as well. So that some of the early concerns that we saw in the Vaccine Equity Advisory Committee and things that my colleagues and research colleagues at Drew began to see very early on was the disparity in access, both in terms of geography and as well as these aspects of race, ethnicity, and income level, that were definitely driven by your ability to drive to your site, because a lot of the early large sites were drive-up sites, and the internet access that was required to go onto MyTurn. It wasn't necessarily a technically difficult process, but it would be one that becomes cumbersome when people had to wait online, and they had a very long time to kind of try and get into these this internet-based registration site. So a lot of the early responses that we encouraged by having walk-up sites, by having sites that you could actually get registration without having to go online, helped to decrease some of that. But that delay also had another impact. If you look at the things that are associated with people today being more hesitant, knowing others who were vaccinated, having friends and neighbors who were vaccinated was also a strong predictor of who's less hesitant now. And so if you had less access in the early phases, you're also likely to be around people who didn't get it. So that also further delayed things. I think the other components of some of what we're seeing in terms of the vaccine disparity and the persistence of that disparity, we really have to be cautious about, because people are talking about hesitancy and reluctance. And there is a good, well-founded history of racial discrimination against African Americans and Latinx members and other minorities in this country that the healthcare system, has a responsibility for, that can also contribute to what we're seeing in some of that hesitancy. But if we really look at the data, the Kaiser Family Foundation has really done a great job of publishing and tracking this. That aspect of hesitancy isn't fixed. It's actually fluid. And in African Americans in particular, it has come down considerably. And the things that are associated with reducing that hesitancy is having a conversation with a physician about getting the vaccine. In fact, if you look at the predictor of what's the most likely thing to influence someone towards getting a vaccine, That's the highest predictor across all races and ethnicities. And it's the number one in terms of African Americans. About 84% of African Americans nationally saying talking to a physician is a really strong indicator or predictor of changing their perception. And so now we have to take a step back. How many African Americans actually have health insurance, have a provider, even if they are insured, and have the usual source of care? And then what's the trusting relationship with that provider? So there's a lot of things that need to be disaggregated. Some of these things are things that are short-term, like Rose mentioned, that, we might have been able to make some changes for. And some of these are things that are more rooted in a longer history of disparity and unequal access to resources in this country.
I want to just concur with everything that's been said. And I want to say that a lot of the individuals that, we came in contact with were just felt discouraged. Initially, it was very complicated to secure appointments through the portals for appointments. I think it was mentioned initially, it was a lot of the drive ups. A lot of our community members do not have a car, do not drive. Also, language was an issue. People didn't have IDs and others. And even just to secure appointments through those portals, because I help plenty people myself, it was quite complicated because you needed to have an email address, or you needed to have a cell phone where you could be texted a security code and so on. So just a lot. And also discouraged because the media focus, we had this tier system for vaccine dissemination. So we started with the essential workers, but then you would hear about, schools in the West Side or in affluent areas who were all getting vaccines. And so just people just feeling kind of discouraged and cheated and saying, I don't know if I even trust this system in general. So people needed help, they needed support, and they needed education, and they needed encouraging. And eventually, that came. But I think initially, even though there was this big surge, it was really a surge of people who really wanted it and who had the means and the capacity to sign up. And then, as time progressed, then, there was greater access and you didn't need an appointment anymore. And also people thought that they had to pay for it. So there was a lot of misinformation. So people were concerned about the cost. Especially when you went onto those portals and it asked you what kind of insurance you have. What does that tell you? Oh, I have to provide some kind of insurance, which in fact you really didn't. You don't need insurance for the vaccine. You don't even need insurance should you get COVID and end up in the hospital. So a lot of education took a little bit of time to get that out to the community.
I want to lean into something that both Mr. Vargas and Celia are talking about, which is a very important conversation that was started in the Black community around the vaccine. And that is something of distrust of our government, a conversation that runs very deep within the Black community of how we've been used in historical context with medical research. And so there was a lot of conversation. We moved very quickly with the vaccine. And so that's caused a lot of questioning of folks in the Black community. So there were several things that were happening at the same time. There was definitely the lack of access and a certain amount of privilege, I guess you could call it, not having an email address or cell phone or what have you, or a ride to get vaccine. But there was also a very, very deep conversation about things that people still can remember and point back to, like this Tuskegee experiment and other things that were causing a lot of anxieties amongst the Black community about how ready we were for this vaccine at this time. And so that was also a very important factor, is understanding the systemic racism and the history of our country with regards to providing vaccines to our African-American community.
Let me, very good points, John. Let me, Khalif, if I may just add a question in here. Look, Dr. Vargas mentioned that our vaccination rates are increasing and so forth. Well, things are going off well, seemingly, but now, today, the mask, wearing mask indoors comes back. It starts today. where does this lead us, and what does that say? Even though the vaccination rates are increasing among African Americans and other minority groups, but where are we now with this mask? What does this say to us? Rose?
Part of the mask mandate that's being reinstituted really is a means of protecting individuals who have not been able to access the vaccine. And so the intent really is, if there are individuals within an indoor setting who may be unvaccinated, then there is still the potential for transmission to those individuals. And so what is being asked from a public health perspective is to be able to assist those who have not been vaccinated, not be exposed to the coronavirus, is for us to be masked up. And so that's part of the concern. LA County certainly differs from the other counties in the state of California, and the differences with the CDC in terms of the mask mandate. I think there is a real concern, and after having heard Dr. Muntu Davis, who's our Chief Medical Officer with the Department of Public Health, because we are still seeing low rates of vaccination in Black and Latinx communities, it is a concern to try and protect our unvaccinated community members, residents, and even family members who may not be able to access the vaccine. Picking up on this theme that Jai, Celia, and Dr. Vargas have shared with regard to the mistrust of the medical establishment as well as government, this issue has come up before. Many of the folks who have tested out and conducted the research trials for the Moderna, AstraZeneca, Pfizer, Johnson & Johnson, and the other vaccines are those of us who've done research in the HIV/AIDS arena. And we saw the same myths, stereotypes, and stigma arise in the early years of trying to develop HIV medications. Oh, the myths included, they're trying to inject us with the virus to get us infected on purpose. Or, oh, this is a conspiracy by such and such in order to, negatively impact my community. And don't trust those doctors. They're just going to experiment on you and not tell you what they're going to do to your body. These are the same comments that we're hearing with regard to coronavirus in the research trials, and the same kinds of concerns and stigma with regard to individuals who may or may not be able to access the vaccine. And I think it's heartening to see that, including, I think, our Kaiser Family Foundation colleagues, Dr. Vargas noted the research that Kaiser Family Foundation has been conducting. They've also been developing video conversations. It's called Between Us, About Us, the conversation, including African American and Black doctors, nurses, and other healthcare leaders to advise folks about concerns regarding the research trials and being able to access the vaccine. And so I think this issue of why are we masking up again? We're trying to protect the unvaccinated amongst us, including many of our family members, residents, and other community members.
Yes, I just have to make sure that we get that point across, because although I did highlight some of the areas where we were able to have a positive impact in getting the vaccine rates, for African Americans in the Latinx community, we still are very far behind in terms of where we need to be to have community level immunity. Specifically looking at the Los Angeles County data, we're still at under 50% African Americans vaccinated and roughly just a little over Latinx 50%. And so when you don't have 70 to 80% of your community vaccinated, you're going to have people at high risk for getting infected and becoming sick. The vaccines prevent, over 99% of the folks from getting severely ill or dying. But we still have very large numbers, of people in Los Angeles County, disproportionately African Americans and Latinx. Where we've done well in the Black community is actually in the over 65 group. And so in our over 65 group, in many of our communities, African American and Latinx communities are over 70% vaccinated, but that 16 to 65 group is really where the numbers are very, very low. And then we have regions, if we look at the unincorporated Palmdale region and other areas like Compton and Watts, we're still, at that 50% level overall. And so what that means right now is with the Delta variant, which is more contagious and potentially more deadly, now coming through as the major strain, in Los Angeles County. The public health department's decision to go back to masking is because we still have very large, portions and pockets of our community that are not vaccinated, and they're going to be at severe risk for being hospitalized and for dying. And unfortunately, that residual group of people who still need to get the vaccine is predominantly African American and Latinx.
Absolutely. Thank you all so much. You really covered quite a bit of what we wanted to discuss. And just looking ahead, considering the many reasons for low vaccination rates, especially in the Black and Brown communities, what are we looking for? What are we looking ahead towards with this Delta variant that is highly contagious? Where will we be back where we were? Or what do you predict? Anyone? Dr. Vargas, would you like to take it?
I'll just weigh in briefly, at least in terms of what the statistics are showing. And anybody who's interested, I think one of the things that we really pushed for with the Equity Committee, Advisory Committee, that the Department of Public Health was very responsive with, was sharing that data publicly. So if you go to the Los Angeles County Department of Public Health website, they have a COVID-19 dashboard that includes vaccine rates as well as the infectivity rates. And I think the most troubling thing that we've seen in the past 2 months is a very steep increase in the percent positive. So everybody who gets tested, what percentage of those people who were tested are positive? And so that about 2 months ago, that was about 0.3%. So less than 1%, 0.3% of the people who tested overall throughout the county were positive. Very, very encouraging. And then from mid-May until today, that number is now 3.8% as of yesterday. So almost a 10-fold increase in less than 2 months. And so that rate of increase, if it continues at the way that it is right now, we're going to be in a situation where we'll have to go back to even more restrictive processes. But even more troubling is the fact that we're going to have a lot of people die. And at this point, because we have effective vaccines, just about every death of anybody over 12 is an unnecessary death. Okay, though anybody who has died, since the availability of the vaccines and the deaths that we're going to see with this increase right now are all unnecessary deaths. So that's, I think the part that, for those of us in the public health sphere are just really so frustrated about and really concerned about. And so those people who are still waiting, those who are still hesitant, we have to get that message out now. That the data is very clear that the safety profile of getting the vaccine is so much better than the risk of you getting infected and dying, and so that all of these deaths that we may see with this new surge that we're facing in Los Angeles County will be unnecessarily deaths. And I think the troubling part about this is there's also that disparity. And so, in Los Angeles County, it's almost a 2-to-1 disparity in death rates currently between Blacks and whites, as well as almost less than 2-to-1. And that, over the life of the pandemic, it was 3-to-1 Latinx to white and roughly 2-to-1 African American to white in Los Angeles County. Now, the Black-white disparity is the greatest disparity in death and in new cases. So we really have to take a step back and really redouble our efforts to get that message out and to maintain, the access to the vaccine.
And Khalif, thank you for that question, because we do have other things as well to be concerned about. As the Delta variant continues to proliferate amongst individuals who are unvaccinated and unprotected, it also has the ability to mutate and evolve. And so I think the last article that I saw shows that they're now tracking a Lambda variant. So if you understand the way that they name the variants, it goes in alphabetical order. So Delta, we're worried about D right now. There's an L version that they're tracking. And the longer that Delta continues to multiply within our communities here in Los Angeles County and across the nation, the greater likelihood that more dangerous mutations might emerge, and that the vaccines that we currently have on deck that are protecting some of us who have been vaccinated will not be effective against future variants. And so the disparities that Dr. Vargas, that Celia, and our other speakers have noted are important, because these disparities continue to lead to the vulnerability, not only against the Delta variant, but against future variants and vaccines that we may have. And I see there's a hand up and there's also a question in chat. And so I'll defer to our co-host to facilitate us.
We're going to come to that. We're going to come to the questions a little bit later, but we're going to take them, but we're going to come to them a little bit later. One of the things is we're going on that fits into all of this is the effect that COVID has had on our mental health. I know that I've been affected, for a very close friend of mine's wife died of COVID, and that affected me in ways that I never would have expected. And I've heard other things, but what other people are saying. Where do we go from here in terms of our mental health? What do we need to do? Because it just seems like things just keep going on. And in fact, I just want to holler and say, COVID, stop, so we can live our life the way we want to. But what do we do about our mental health? Anyone, say, Dr. Vargas, Rose, who would like to take that?
I guess, I mean, I could just, stress that too, that we need to do something. And I think the isolation that we've had due to COVID did not help. And also just the economic situation where most people, their jobs were impacted and their finances were impacted, and housing and food insecurity, all of that added stress did not help our mental health. I mean, even for those who normally did not report struggling with mental health or depression, the pandemic definitely has brought some of that on for a lot of folks. And I think the problem with is just the isolation. That's like one big thing that folks, are basically living in silos, and they're just trying to survive and put food on the table for their families, and their own mental health, their own mental state is basically on the back burner. And there's not a whole lot out there in terms of getting people out of isolation and integrating and having them engaged in community activities. I mean, there are several agencies that are focused, and there's funds that have been poured into get community engagement and helping folks, especially those impacted by trauma or those at risk of trauma, to get them engaged in community, programs. But I think folks are trying to survive right now. And it's very difficult to tell someone, come to our town hall or come to our, food distribution, or to the, our parks and recs program in the evening hours or whatever, when they're just trying to survive. So I think right now we're kind of trying to help people with I work for a community-based organization. We've overextended ourselves. Like, we focus on health, but really we're focusing on so many things, and we're trying to, assess for what the family needs in order to help them survive and stay afloat. So it's all been kind of just like, almost like putting a Band-Aid, like, let's fix this, let's fix the next thing. But really, we just need to help people get to a stable point so that we could help get them out of isolation and get them engaged in programs that are out there that could benefit them all and benefit their mental health. And that's one. And then for severe mental health issues, well, that's always been a challenge because capacity, to find mental health providers that could see people. If you call the LA County Access Line to try to get someone mental health services, they don't get appointments till 4, sometimes 6 weeks out. And people need help now. So, yeah.
This is Dr. Shervington.
Oh, Dr. Shervington, great, welcome.
Thank you. So I share a few thoughts, and maybe we all just need to take 1 second to acknowledge that we're all suffering, that we're all facing a deadly virus that with a breath could be close to the last. So it's not just those people, all of us are suffering. And when our bodies perceive that there's a threat to our survival, we're going to get activation of our stress response. So we all have increased levels of stress hormones in our bodies. In fact, if we don't, there's something wrong with us because we're all facing a threat that we could die. And so when that happens, we're really at risk for developing anxiety-based disorders. So the challenge we all have is to find ways to manage our anxieties. We also, many of us have had losses. And as was said earlier, we don't know how much losing is going to impact us. In fact, I heard someone say that the extent to which we grieve is the extent to which we have loved. And so what I think as a community, as a city, as a country, as a world, we're going to have to come together and find ways to support ourselves. It doesn't have to become clinical. If we acknowledge we're more anxious, we're more depressed, there are many things we can do to soothe ourselves. The breath is the number one tool that we have to focus on calming our bodies down. Movement, creativity, being in nature, all those things around us that are soothing, but perhaps most important, we need community. We need to find those communities where we can be vulnerable with each other, where we can support each other. And I think this is how we're going to make it through the pandemic. As a human species, we've faced these challenges before. I come from a city in New Orleans where 80% of the city was destroyed. And resilience is about facing the reality of the threat and then figuring out how to manage. So I encourage all of us to acknowledge that we are all facing threats, but if we find ways to manage and deal with our stress, our anxiety, our anger, or pain, we can make it through.
Thank you. Thank you for those words. And we're going to come back. Khalid, can you introduce one of our young people to ask a question, and we'll change things a little bit after the student, our young person asks a question. We'll take some questions from the chat room because we're getting quite a few coming in. Khalid?
I don't want to be seen then.
I turn the video on.
Hi, so I'd like to introduce next top teen Joaquin Bryant, first vice president of the Inglewood chapter, who will ask the next question.
Hi, so how are you guys doing today? Being like another young person like in America and being a young person throughout the pandemic, there's been like a lot of different problems when it comes to mental health with my friends, family members dying because of COVID, and people just feeling lost within sight of COVID and this opportunity. Well, it's not really an opportunity, it's distress. But can you please discuss suggested strategies to promote and ensure opportunities for safe mental health for our families, especially people like me and our youth, despite having experienced isolation, illness, loss of jobs, school closures, and now perhaps even the death of more loved ones?
Dr. Shervington, maybe you could address that.
Yes, I sure will. So focus in a little bit on the needs of young people. I'm so happy that you're here. I'm so happy that you are acknowledging that it is equally as challenging for young people. Oftentimes we forget that young people perhaps have more challenges because either they don't have the language or they're not seen. We're not acknowledging that, yes, we are all suffering together. And I think one of the things you have is the value that's placed on your youth and your resilience. Your brain is much more plastic and able to shift to new realities than those of us who are older. So at least I want you to be aware of your resilience and your capacity to come through, experience something that's hurtful, but finding new ways to survive. So what I would recommend Joachim, is you find your group, the group of folks with whom you feel you can tell the truth about how you're feeling on any given day. You know, man, I'm not feeling so good today. I found out someone lost something. I'm just feeling nervous. I'm feeling paranoid, because none of us have real answers, but together, individually, we can support each other to manage the things that we're feeling. Also, the things that bring you joy. So what it is there some creative endeavor? Do you like music? Do you like dance? Do you like art? Those things are very healing for our mind. Mindfulness is something that is really simple and easy to engage in. Taking few minutes each day to just stop, to just kind of quiet your mind and say, I want to feel what's happening in my body. I want to understand where the stress is. And I just want to bring the breath into that space. You'd be surprised. It seems simple. We've done mindfulness in schools. My work in New Orleans, doing yoga, mindfulness, encouraging martial arts. Those are things that are really helpful. Now, I know with the virus, being in spaces, enclosed spaces are difficult, but one can create one's own practice. One can create virtual connectivity with other people. And I know we're thinking about going back into schools. And so having the educators be willing to sit with young people and say, look, what's happening to you today? How you're feeling? Those are some very simple things we can do. But the first thing is just to acknowledge that as young people, you're struggling with this pandemic just as much as all of us are, and find ways to help you tap into your capacity to be strong, stronger than the virus, which means you have to protect yourself from it and then try to keep your mind from not getting too anxious or depressed.
Thank you, Dr. Shervington. One thing I will say is just, being a part of this conversation, it really does reinforce the idea of community and the importance of leaning into each other and being there for checking in on folks. And so I really appreciate your response and that question, Joachim. Next, I'd like to introduce Teen Jessica.
I wanted to lean into that just a little bit more before we move on, because you and Dr. Shervington both touched upon it, which is the sense of belonging, which is very critical in positive youth development. As a young person grows, their mental, physical, social, emotional well-being is very critical in how they develop into positive pathways to adulthood. And Dr. Shervington really outlined the resiliency of a young person. But one of the other things that young people have a leg up on us older folks is, again, that adaptability. You all are already so connected outside of actually connecting in physical spaces through social media and other ways. And so I would encourage you to lean into those abilities to connect with your peers using those platforms. You guys have been the vanguard in establishing what social media can do in order to connect and share messages and uplift across the country. And so there are lots of resources in finding and connecting with like folks. The sense of belonging is very, very crucial to a young person's development. And there are also organizations that are still continuing to serve young people, and there are resources, and I can help you connect young people to resources in the community within the Los Angeles County if need be.
Thank you, Jai. So next I'd like to introduce Teen Jessica Hayes, President of Top Teens of America Inglewood Chapter, to ask the next question. Jessica.
Good morning, everyone. I know the pandemic has raised a lot more questions, and one of the biggest ones is what's going to happen next? So what can we expect the effects of the pandemic to be on the next generation over a period of time? Are job opportunities the best way to mitigate these damaging effects on our youth and offer tools for resilience and optimism?
Great question. Who would like to take that?
I'm going to defer to my colleague, Dr. Shervington, on the next steps in terms of mental health and overall well-being and her experiences in New Orleans. I think one of the things that we do need to be mindful of this question of employment and the economy right now. With us losing a year of school for many students, I think for those who are in situations where you can't necessarily work from home and stay employed via Zoom, the disproportionate amount of folks who are in those situations that are not actually thriving and have been isolated from that aspect of the economy are things that we do have to be mindful of as a community. The African American unemployment rate is around 9% compared to 5% for others. And then when you look at Black male unemployment and younger Black men, that disparity gets wider. And in California, we're in a fortunate situation. The state has done very well. There's a $75 billion or so surplus. I think nationally, as we look at the new bills and legislation that are being passed, this is an area where those of us who can influence our legislators to really ensure that those individuals and communities that have been left out or have been disadvantaged by the past year really do get that support. And that may be job training, that may be direct financial support, that may be making sure that individuals who have been locked out of educational opportunities get the scholarship support, the financial support to get back into that training. So I think that that's something that we have to really push for, advocate for, and change we need to make. And those of us who are in those positions who can advocate or push for that, we really need to be mindful of that.
Jai, do you want to offer some comments on that, Jai?
Sure, absolutely. You read my mind. So as we think about the way out, and the way I'm choosing to interpret this question is really above and beyond just the pandemic itself, but a lot of the things that the pandemic brought about. So in May and June of last year, as a country and even the world, we experienced a social justice awakening that highlighted quite a few things with regards in inequities in our country and in the world. And so what I've been involved in at the California Community Foundation is developing a Black Empowerment Fund. And the fund is really to acknowledge these persistent barriers that have really been rooted within our communities and our country for so long. The goals are really to invest in strengthening the infrastructure of Black-led and Black empowering organizations, to focus on power building and systemic transformations, as well as to reverse the pattern of underinvestment in Black-led and Black empowering organizations so that the Black community can thrive. And the third is to support the ecosystem of organizations and infrastructure that are engaged in moving forward the agenda for Black equality. And my thought process and how I'm trying to lead the team and the organization to think about this is really to unravel the cyclical or ecosystem nature of philanthropy and the Black community. We must recognize that we are part of a process that allows access to certain communities. We steward funds on behalf of wealthy individuals to decide how much, when, and to who resources should be given. So the word empowerment is very strong within this, how we divide this fund, because we are choosing to invest in organizations that are trying to empower and break the cycle of need within the Black community, to empower Black folks to be able to build their own social and economic prosperity. And so in order for us to do that, in order for us to really think about lasting change, in essence, we are trying to work ourselves out of a job within philanthropy. Because we need to understand that the Black community organizing groups and the networks needs to be supported to strengthen this leadership pipeline and bring organizers to create policy changes that advance social justice. Policy and advocacy systems reform is important to fund the multi-issue work that allows intersectional approaches to address the complexity of anti-Black racism. Economic development, economic empowerment, wealth building and creation is a major strategy towards better opportunities for the Black community. Research and intellect advancement. It facilitates a change in the Black community for stronger connections between Black researchers and research organizations are needed to carry out the relevant work and the experience to
I see Jai's, Jai, are you back? His Wi-Fi has faded on us through here. Jai, are you there? Okay.
Yeah, I'm here.
Okay.
I'm here. Can you hear me?
Yeah, you faded for a while.
Oh, I'm sorry. I'm getting that your internet connection is unstable. I'll go off camera for just a moment. Hopefully that'll help. So yes, as I was saying, it's really in thinking about the multiple levers, and I was just talking about the research and intellect and advancement and how that's crucial to have folks who are actually Black who are helping to understand the true needs and to lift up the needs of the Black community move forward. But there's also a strong communications and narrative that is a social power to change the Black, in order for us to change the Black community is intrinsically tied to the narratives of who Black people are. And so it's important to strengthen the media and strategic communications to advance accurate portrayals and images of Black realities.
I see the bedevils of Wi-Fi have gotten to us.
Okay.
Let me, we'll come back to this, Jai. I want to go to a question as we're waiting for Jai to come back. I want to go that came on the chat line. Someone was asking, is there any research around the vaccine with regards to the impact on fertility? Who would like to take that? Dr. Vargas?
Yeah, I'll have to just say that I think. Oh, can you guys hear me? Yeah,
I think you're muted.
Can you guys hear me?
I can hear you.
Yeah, the most recent data that we have does not support or suggest that. I'd have to kind of just make sure that we're very mindful of a lot of the dis and misinformation that's out there. I think
we're having trouble all over the. Dr. Vargas, are you?
Can you guys hear me?
I can hear you.
We can hear you.
We can hear you.
We can hear you.
Yeah. Yeah, we can hear you loud and clear.
Okay, great. Yeah, and so I think the biggest issue that we're dealing with right now in terms of dis and misinformation, is this aspect of getting trusted and evidence-based information about the vaccines. There are a host of rumors and things that are going around on social media that really are not supported by the evidence. And so I think that we have to really deal with a lot of the misinformation and the risk of people waiting to get the vaccine, reluctant to get the vaccine that's not based on good information. I think in terms of an individual decision to get vaccinated and your risks of getting COVID versus some of the side effects, there's been, millions of vaccines provided. The data still strongly suggest that you're better off getting the vaccine than any of the side effect profiles that have been documented or demonstrated. I think it is a valid concern to think, well, years out, we won't know exactly what will happen because I think we can't say, with any certainty what would happen over that longer period of time. And so we have to be honest about that. But we also know that short term, the risk of COVID and getting infected with COVID have some long-term effects as well. So there's a long-term haulers of people who get infected with COVID. There are long-term consequences that we know very well. So the upfront risks, for example, the risk of pregnant women having complications and dying from getting infected with COVID they outweigh the risk of getting the vaccine if you're pregnant. And so that, the data that we actually have to look at this demonstrate this. And so that, I think that these concerns that are there, there are always going to be a lot of what if scenarios about things that could happen. We have to balance that with the facts. As Dr. Venegas mentioned earlier, the development of these vaccines in terms of the research period, the period of actually, doing the research and studying is the same observation period of the phase 1, 2, 3 in clinical trials of all other vaccines and FDA approved, drugs that are out there. What was different is that the companies decided to produce them before the studies were complete so that we'd have them readily available. What was different was the decision to start the process of the clinical trials were not delayed by saying, is this going to be something that's profitable for us to do? We were in the middle of a pandemic. So the things that were moved along faster are things that, were not anything that would cut down on the safety profile and the efficacy of any standard drug or vaccine that goes through the process. Now, after the vaccines have been out, okay, we've had hundreds of, probably over 100 million or so folks receive these vaccines in the country. And we're now at a point where we can actually look at what's happening post-vaccination. And that profile has also, been something that we can look at to demonstrate that the risk after getting vaccine of millions and millions of people getting the vaccine are still much lower than the risk of getting COVID. Okay, and so if there's ever an individual concern, I think the key thing is that's when you have to have that conversation with your provider. I think I go back to that Kaiser Family Foundation data, and I think that, having a conversation to say, am I individually at risk with a trusted provider is really the thing that will hopefully reduce some of those individual concerns that people have. I think one of the unintended benefits of COVID is that telehealth and telemedicine, talking to your provider over the phone, is now something that's reimbursed in a way that's a lot easier than it was pre-COVID. So for those of you who have doctors, if those of you have access to care, that's something you can do. Those of you who don't, at least in California and other regions, Covered California is available, and there are other things that you can do to get that information. Then there are other trusted sources. So the CDC website is one. I think at Charles Drew and the historically Black colleges and universities, we've done a great deal of work in terms of getting these messages out to try to reduce the fear and mistrust. And so, so the short answer to this is that there is currently no contraindication outside of having received one of the first shots and having had a severe reaction to getting the vaccine at this point. And so I think that, we really have to push folks to have that message get across. And I think the bigger challenge is what people see on social media when they hear these things about magnetism, all types of things that are being put in there, is that the algorithms that you're seeing on your Facebook profile, on your Instagram and TikTok, all of these things are being sent to you by a computer algorithm that is not vetting the accuracy of the information. The only thing these Facebook and all of these algorithms do is say, how many times has somebody looked at this? And are the people who have looked at this looking at advertisements at a long period of time? And are those people similar to you? And then they send that to you. So you're getting these feeds, and you may think that these feeds are coming to you because they're valid, because they're evidence-based, but they're not. They're done for marketing and for promotion. And so we really have to be careful about what you're getting and realize that you're getting information sent to you many times based upon no evidence whatsoever. And so I think that's some of the things I have to really make sure that we get out there, okay?
That's a great point, because that's a really impactful way that the youth are getting messaging is through social media. So I'm glad you addressed that point. Thank you.
As we're going, Khalif, you want to ask the next question?
Sure. I think we've pretty much addressed the next question, David. So we can maybe move on to talking about the prognosis for the job market. I'm not sure who might want to take that, but if anyone could take a look at what the prognosis for the job market as it relates to young people of color in the future, with so many people having gone through job loss, if there's any hope in the future for the job market to sort of have a resurgence. Anyone want to take that?
I'll assign it to Jai since I cut him off before, because that's something that I know that he's deeply involved in. Jai?
Yeah, so Dave and I actually talked about this a little while ago in the context of 2008. You know, we as a people, we always learn and adapt to how to do business differently. And we've already seen it happening as businesses are starting to reopen and they're switching their models. You know, what we've also seen is an insurgence of things that are that can be done remotely. We've seen a surge in folks that are available to deliver, such as Amazon and DoorDash and things like that. And so there are different types of opportunities that are available for folks to be able to be creative and innovate. But what we're also seeing is folks who are taking time to learn different trades. We're seeing a lot of young people pausing on their traditional college pathway, mostly because the social aspect of college is not going to be there because of distance learning and so forth and not being on campus. And so they're taking times to learn other skills and other trades in the interim. And so it's really about taking this time in this moment. Also, you know, with the social emotional piece of it, to figure out, take a moment to be still and to think about some of the other things that might be available to you, some of the things that you might want to add to your toolbox. So when I think of young people, I've been encouraging them to think about some of their other passions, some of the other trades, some of the other things that they might be able to do in the interim. Going to community college and deferring a 4-year track to save monies and do those things online that might be inspirational for them to venture out into alternative pathways they might not have been considered previously.
You know, as just to amplify, is that we will probably have one of the largest job markets, most active job markets over the next couple of years than we've had in a very long time. But as Jai said, is preparation, preparation, preparation. And to get a good job really means you have to have 2 years of post-secondary education and beyond. Let me raise the question for all of the panelists, if you would answer very quickly. What effect do you think the American CARES Act will have on our community, and specifically here in LA County? Rosemary, I'd like to start with you.
Thank you, David. And I'll also bridge, I think, from the previous question with regard to the workforce and jobs outlook. I'll make a pitch for the health services sector. The things that we've discussed today on this call are the needs for care, healthcare, mental health care, you know, social connectedness and those types of things. Those are all going to be boom industries with regard to jobs. We need more public health staff to be able to continue to track this virus and certainly other pandemic viruses that may emerge. We need folks who are going to help us connect with community members who are not vaccinated, educators, health educators, people to help people fill out forms and navigate the next round of vaccines or what have you. We also need folks who can provide that kind of social connectedness and even navigation of systems that Dr. Shervington and Dr. Vargas talked about. So those are areas where the CARES Act certainly has invested in and will continue to invest through the end of this year, which is when the CARES Act expires. There's also the American Rescue Plan, which there's $1.9 billion that's already been transferred to LA County, including a significant portion that LA County will be looking to invest in workforce development. Similarly, the city of LA has received over $1.3 billion, some of which will be tagged for workforce and skills development for community members. And so the areas that I would predict, and perhaps I have a bias being someone in the health area, would be certainly in the health sector, whether it's public health, mental health, or even general primary care and some of those other services. And so I would encourage folks, I know we have educators on the call and folks who are invested in our education systems, to look at the science, technology, engineering, arts and math areas, so the STEAM and the STEM as we've called them, to be able to understand how pursuing skills and knowledge in those areas can then prepare you for additional education and ultimately jobs in the region. We've seen the governor also make promises about investment in terms of workforce for individuals who might provide some home health assistance to our aging or medically fragile community members. So there are opportunities on the horizon, opportunities for training that would then lead to paid positions that are above the minimum wage and are approximating a living wage. And those, I think, are areas that we need to look to. But to David's question, what do we have to look forward to? What's the next thing on the horizon? Really is thinking about what are the long-term effects of COVID? There are many folks who are developing additional longer-term symptoms, and we don't yet have a good grasp on what that full collection of symptoms may be. Many of us who've signed up for the symptoms reporting after vaccine continue to see reports coming out of the CDC and other institutions around new symptoms that are being identified, including the most recent cluster with regard to neurological symptoms, primarily amongst men, for a very small portion of folks who've been vaccinated. But certainly these are symptoms we'll continue to track. Our health systems, including hospitals, clinics, and others here in LA County, are now tracking some of these kinds of symptoms. And there are studies being funded at the federal level to look at what's now being called long haul COVID, or longer term symptoms that develop in individuals who have contracted COVID in the past year or so. So I think we do need to look forward to additional research, certainly tracking additional symptoms that may or may not emerge with regard to the vaccinations. The upcoming data and studies that are being conducted in terms of reproductive health. I know that's an important question for many folks that is still being assessed in the data. And this issue of long-term clusters of symptoms related to contracting COVID. And so those are the things that I think we'll need to be tracking in the coming years. And also as we continue to see the variants emerge with regard to this virus.
Dr. Shervington, I see you can. What impact do you see American care, especially in terms of the areas of mental health?
I certainly think we are going to have to think differently about the traditional ways in which we have provided mental health services. We're going to need much more peer engagement and perhaps to be able to support those activities. I think we're going to also have to be able to have community-based kinds of wellness services that are considered part of health. So I'm challenging, usually philanthropy does not like to pay for health services, but you might want to consider that keeping people well. To me, the challenge now is to keep all, and I don't want to say people and not include myself, keeping all of us well enough so that hopefully we can ride this through. So what are some of the complementary or supportive things? And I think that we can, however the funds are being considered for distribution, we're going to have to think of a different way of thinking about mental wellness, and be able to see that as having value in being resourced, either by training up more peers, more community health workers with a focus on mental health, or seeing some certain activities that can be done in community organizations as deserving of reimbursements around health provision.
Ms. Valdez. Say, if you will unmute, they say.
Okay, there. Sorry about that. I'm like on my phone and on the computer here. I had to unmute myself. Yeah, I agree. I think that the work. I think the connecting the folks becoming engaged and using more of the social media for for that engagement. I know that earlier there was a question asked about, how do we get the young people involved and how do we get them out of, isolation and help them in terms of their mental health. But I was also thinking about, using our youth to not only do a lot of this community health worker work around COVID, to promote the vaccine and help people access the vaccine and dismiss some of the fears of the vaccine, but also to help older individuals connect online. Because even though a lot of stuff is opening up again, the kids are going to go back to school. We're still in this pandemic. We have this Delta variant that doesn't seem to be going away anytime soon, but really helping those individuals who are not familiar with the social media platforms or even just Zoom connect so that they come out of their silos. There's so many work groups and support groups that are available online, and people don't know how to access them. And I think they reach a much broader audience than if you're just holding an actual, in-person support group. So I think that it's a way of evolving, but it's a way that we could utilize our youth and also get people more. So there's new opportunities to get people involved and to get them, get them in a better place and get them connected to programs that could help them on a day-to-day. And the rescue plan, there's monies that have been allocated for some of that work to sort of engage with the community. And the CARES Act, has been funding the community health worker program. And a lot of youth have been employed through those programs to go out into the community. But I really think that, we've evolved in terms of using more of the social media platforms. And even though they could be a little bit dangerous and there's a lot of misinformation, but at least to get people connected and talking and helping them feel better and helping them learn and helping them sign up for things that they didn't know they were eligible for. And yeah, so that's my stand. That's my opinion.
Dr. Vargas?
Thank you. I think I'd probably make a plug somewhat in line with many of the comments there, which is about how we can really use the resources that are coming to reinforce and design a better integration of all of our social services and health systems. I think that, the ecosystem and the relationship of health, mental health, to things like economics, having a good job, public safety, we really have to think about these silos in a way differently moving forward. What COVID really unraveled for many of us was, the risks of the siloed nature of our society. Even just at the basic level of public health and clinical and medical care, the ability of us to really look at a region where there is a lack of vaccines and a lack of insurance, and where we could actually get people into care to have that conversation with the provider to deal with hesitancy, to deal with folks who have already had COVID and need to get care to get follow-up, care and treatment. When we look at this as from a research perspective, we can see these pockets, we can see these gaps, we can see these geographies and these populations. But the coordination of services and saying, can we get everybody who wanted to have a medical home? Can we look at these communities that have not had those prior resources and find out what's the best way to deal with employment disparities so that those individuals could actually have an income that wouldn't put them at the social risk of poor health. And so this is actually a design issue. I think one of the things that when we think about federal funds that are coming down in hundreds of millions and billions of dollars, state budgets and coffers that have several billions of dollars right now, it can no longer be the excuse that we just can't afford to get everybody access to care. We can't afford to get people access to mental health services if they need them. This is a design issue. And so that resource won't be forever. And so I think that if we're not really intentional about how we use the resources that we currently have, we're going to miss an important opportunity. And the way that the pandemic hit us and exposed these disparities give us really clear targets right now for things that we could use to bring these resources together in a more constructive way. And so it's a design issue. And I think that that's one of the opportunities that we really have to take a step back and think about and say, how can we design a system that's going to not have the same inefficiencies and siloed nature that really laid bare a lot of the infrastructure problems and really have driven these disparities.
I was trying to remember the term. I think you made me remember that. It's the telehealth. So we use telehealth for a lot of the medical appointments now because of COVID. People have not been able to necessarily see their doctors in person, or at least they weren't able to for a while. I think those in-person appointments are starting to come back, but using telehealth to our favor to address these social needs, the social determinants of health. And a lot of us have shifted to telehealth work, but people don't necessarily know that there's so many folks out there that are committed to helping them and helping them address many issues or many barriers that they may be facing, and just really increasing accessibility. For me, I think it's just making sure that folks can access all the services and know that there's health coverage for everybody, and know that there's protections because of the pandemic. We have this moratorium where we can't suspend, thankfully, we can't suspend people's health benefits. We have to protect their health benefits because health insurance and health coverage is so important, especially during this time. So, so just increasing, for me, I think it's increasing accessibility for telehealth to address, so many other issues outside of just a medical appointment.
In our remaining time, and one of the things that we're dedicated here to Stovall is to start on time and to end on time. Are there any burning questions that you can put on the chat for us to give out? And as the questions will be coming through, I'm going to ask each panelist very briefly, 15, 20 seconds, to point out what wakes you up in the night. What are you concerned about? 15 to 20 seconds, no more than that. And Dr. Shervington, may I start with you?
Well, my concern is that if we do not pay more attention to our minds, our interiority, many of us are not going to have the resilience to make it through a disaster, the pandemic, which is a disaster, which is threatening our very life.
Rosemary?
Variants keep me up at night. If we don't vaccinate as many people as possible in our communities, the likelihood of another variant breaking through the defenses of our current vaccines is going to be highly likely.
Ms. Valdez?
Just people unable to access programs that can improve their lives, and people just suffering right now and really just trying to stay afloat and keep a roof over their heads and food on the table for their kids. And sometimes their health is on the back burner because they're just trying to survive. So that stuff keeps me up at night.
Jai?
Thinking of this social awakening as just what's in vogue and not becoming a persistent conversation. We often think of this, talk about this, something new and shiny comes along, and then we forget about all the conversations, all the deep work that needs to be done. Wanting to not look back and think that we were having this conversation when I was blah, blah, blah. as I grow older is very important to me. That keeps me up at night. I want to see the solution in my lifetime.
Rosemary? Oh, but I'm sorry, Dr. Vargas. I'm sorry, Dr. Vargas. I'm sorry.
I think it's complacency. I think that people getting comfortable, getting complacent, and not staying vigilant and employing all the things that we know can prevent all of the both primary consequences of this pandemic, which would include being vaccinated, and for those who aren't, to continue to have social and physical distancing and masking, and then to really get complacent about these other consequences, both economically, mental health, and in terms of the disparities that were laid bare. And so we have to stay vigilant, and we all have different strengths. We come from so many different sectors. I thank you guys for bringing this panel together. It's encouraging to see us being able to come together and highlight these different components. And so we all have to stay vigilant. So complacency is my biggest fear.
Khalif, I'm going to bring you, even though you're not officially on the panel, but I would like to hear what you, since you work with young people and you are in the health area and you come from that of generations of health, what worries you? What keeps you up at night?
Definitely the impact on the youth and the young people with the closures of schools and the lack of support services that they have available. That definitely, as a mother, as a nurse, that definitely worries me, what they've been going through. I mean, we've all experienced a really rough 18 months, but the effect on the youth, this is going to be really far reaching. And I hope that everyone who has a young person in their life really, stays close with them and reaches out to those who may not have someone in their lives.
Thank you. Please go on the chat line. There, as opposed to questions, there are people who've made comments. There was one in terms of really honoring our nurses, in terms of what they have done through the pandemic and what they are doing. Then the young lady asked, she's looking for an internship. What should she do? And there were some comments on that. This is very important for all of us, this conversation, because it talks about where our communities are going and what we need to do. This is just the beginning of what Stovall is about. And through here, I'm going to turn it back over to our president of Stovall Foundation and a person who has been deeply involved in this community for many years, Lance Williams.
Thank you very much, David. Can everyone hear me? Okay, I see Khalif shaking her head. Yes. So first of all, thank you all very much. But before I say my few words, we've got a polling function. We've got a polling. We want to hear from you. So if you have not already taken advantage of the polling function, please do it now, everybody, because that's a very, very important component of what we want, which is feedback. Now, this is the first event that we have put together, and it was inspired by the events of the day. So please understand that as a foundation, Stovall has historically wrapped our arms around things that are breaking, both breaking news as well as breaking solutions. So we've talked a lot about solutions today, and our world will only be better if the kinds of solutions that you've offered have been really analyzed and also vetted for their value to making this world something that we all can live in a very, very comfortable way, as well as looking at the future. So first of all, again, I want to remind you, please go to the polling. We've got a few opportunities for you to comment, as well as there's an area where you can put your name and your email address for future events. So we really like for this to be something that you take very, very personal and very special. And we want you to be part of this. You all are family. We'd love for you to become a regular at these timely and compelling events. And please tell your friends about what a great show they missed today. I mean, it's been fantastic. Our next event will be a follow-up to this event within a month to 6 weeks. It's in the planning stage right now. We will focus on the current state of mental health in our county, various communities. So for example, we want to look at the African American community. We want to look at the Caucasian community. We want to look at the various aspects of the Latino and Latinx community, because we know that all of these communities are very, very disparate. We want to look at the Asian community. Los Angeles is it's the biggest polyglot in the world of different cultures. For example, there are more people of Cambodian Khmer speakers in Los Angeles, in the Los Angeles area, than anywhere else in the world, other than the capital of Cambodia, Phnom Penh. You could say the same thing for the Samoan community. You could say the same thing for other communities. So we want to really look at how communities are addressing the issue of taking care of each other, taking care of their own. In October, we will present a panel on artificial intelligence and its impact on communities of color. Now, when you pick up the phone to call AT&T, or when you call the various credit card companies and so forth, you know that you're not speaking, for the most part, to a live person. So we want to look at the impact of artificial intelligence. We want to kind of pull it apart, dissect it, and we really want to continue to solicit your ideas about what you think would be some really great topics for us to launch this. So keep in mind that, as I say, we're in a very, very nascent stage, a very nascent stage. We're just beginning. So we envision that we can really, really, really have impact. I mean, just think of the fantastic comments that we heard from all of the panelists, and really, really thank all of the panelists. As a matter of fact, if you all wouldn't mind unmuting, how about giving a hand to the people that presented this great information today? So would you unmute your and just give everybody a hand? I mean, it's just really good. Just really, really, really good. And you know, those of you who are friends, those of you who really lent just great information. I mean, it's just amazing. It's just amazing. And we'd like to really provide to Hope Crawford and the top ladies of distinction and the top teens. I mean, you all showed up and showed out, and really want to thank you so much for the contributions that your teens made to this event. It wouldn't have been as impactful and dynamic, and just really looking at a different side of what's going on in this world without you young leaders. And we certainly know that we are setting the stage for what you are going to do going forward. As you can see by today's event, we're committed to bringing the best and brightest voices before you that we can. That's been the Stovall trademark throughout the years. I mean, that's what Dr. Leonard Stovall did when he created his concept of how to serve communities that historically had not been served. So in many regards, based on the research that has been discussed today, that is still a critical factor. So I want to thank also David and Khalif, because you did just really a great job of bringing this issue and being very selective about the kind of questions that we put forth, as well as listening to the speakers and then bringing back some things. So this was just very remarkable. And lastly, I'd like to thank the technical staff, because there were a few challenges, but really I want to thank everybody. People were patient. They when there were issues, they let us know, and we tried to jump on it as much as possible to get you in. So thank you very much. We're gonna keep working on this. We're gonna keep making this very interesting, and also know that, as you can see, we're recording it, so it's going to be available shortly, and it's going to be part of the archive and the legacy of what Stovall represents. So with that, if anybody has any last comments, certainly it's time to do that. So if anybody wants to speak, it's just open. We've got about a minute.
Lance.
If anybody wants to say something, go
Lance,
ahead.
real quick, please keep speaking, because
Okay.
Tilo is working on a alternative poll mechanism, and it will be
Okay.
posted shortly.
Okay, very good.
I
That
think
was for
Alicia had a question a while
okay.
ago. I'm not sure. if
Yeah,
it been answered.
Alicia, was your question answered?
Actually, it
Alicia's-
wasn't oh, can you hear me?
Yes.
Okay, it actually wasn't a question. I just wanted to add something a while back to what Dr. Vargas was saying. There are tons of opportunities and resources for people who are interested in receiving the vaccine. And by working with Department of Public Health's COVID call center, even people that are shut in, there are people that will come out to them and provide the vaccine. Uber has actually worked with those who needed rides to vaccine sites. So there are tons and tons of opportunities for people to receive the vaccine, but they have to be interested. I think the hesitation and the lack of education, like was mentioned, is key into those that have not received the vaccine. Again, there are so many ways people can get a vaccine. And working on the call center, we've explained to them that it's free because, as mentioned earlier, health insurance was a concern for many people that were calling and trying to make appointments. And we let them know that, it's free. You don't need health insurance. What else did I want to add? Really quickly, in terms of the youth, I noticed it was never mentioned about the suicide rate for teens during COVID. And working the call center, and two of my colleagues who have had teens that committed suicide during COVID, simply due to the lack of socialization. These were children who were so accustomed to being around their friends, being in organizations, and the fact that they were separated from that led to a depression that they didn't talk about, which led to suicide. So suicide was one of the issues I noticed that not only wasn't brought in the media, maybe because they didn't want people to panic, but it just hasn't been a topic that was talked about. And I feel that this is an issue that relates to the youth and is ignored by the youth, for the youth.
Thank you very much, Alicia. Working at the call center, you provide an incredibly important, probably under discussed service by being the first line of communication with many people who are in very desperate straits. So we have two hands raised, and let's start with our stalwart board member, Adrian Thompson. Adrian, your thoughts?
Lance, I wanted to take the time to thank a few individuals on the call who represent some of the Divine Nine organizations that have done an awful lot to assisting the community. I know we have Conrad Carter, who is from Omega Psi Phi fraternity, and a number
Hello,
of members
everybody.
of the Alpha Kappa Alpha sorority and others. And last, I would like to add to the discussion on psych mental health that the Charles Drew University School of Nursing, the Mervyn M. Donnelly School of Nursing, specifically offers the psych mental health nurse practitioner track. And there are a number of nursing students who have significantly contributed to the COVID testing site that began at Charles Drew University and have been very instrumental in providing vaccines at various locations throughout Southern California. So I wanted to give some strong recognition to all healthcare providers, but specifically schools of nursing who have been actively engaged in both the psych mental health component and the community and home health component. And thank you for your leadership as well.
Thank you very much, Adrian. And certainly we have discussed the role of nurses in the frontline work of this COVID issue from a mental health perspective. So we know that going forward, we're going to elevate that to having them as part of our panels. Is that correct?
Absolutely, yes. We look forward to it.
Okay. Stephanie Powell, Dr. Stephanie Powell, another one of our really great board members, has her hand raised. So Stephanie? Are you on mute?
I was. This is great. And I just have one very quick question. So I work with a very vulnerable population that does have the ability to keep the spread going. I work with human trafficking victims and those involved in prostitution on Figueroa. My question to you is this, and I will put my email in the chat if it's better to answer that way. But what I would really like to see is some ability that health professionals can work alongside nonprofits working with human trafficking victims to be able to get them vaccinated on the track. Because what they're not going to do, they're not allowed by their pimps to even go to a health facility. So that part's not going to happen. So it's probably going to be something where we would have to bring it to them and working alongside a nonprofit organizations that deal with human trafficking. So it's just kind of an idea of a forefront idea of what we can do as it pertains to that. And I will put my email address in the chat.
Thank you very much. Do we have any other comments?
This is Hope Crawford. I have a comment, and thank you, Dr. Lance, for this great opportunity. My teens were represented very well. And I also like to say thank you for all the top ladies that have joined us. We do have my first vice president, Lady Juanita Dawson. She is on the screen here, and many others. And I just want to say thank you for this opportunity, and we look forward for many more to come.
Very good. Well, we're really glad that you stepped up. We want to thank Adrian for introducing you. And certainly you all, again, showed up and showed out and participated. Those young people, I mean, I'm sure everybody was very, very impressed with the way that the young people asked those questions. Because, you know, asking the right questions is very important in these kinds of thoughts. So is there anybody else who has any comments or thoughts?
Lance,
again,
real quick before Pam takes the mic.
Yeah, Fred.
Tilo has put in the chat a link, and we just simply ask if everyone could complete it. It'll be confidential, and we'll use that information to help move future events.
Okay, very good. So Pam Hills, we want to hear from you.
Hi.
Oh,
what a wonderful program. Thank you for all of the effort that went into it. Lance, wonderful job. And I'd like to give a special thanks and acknowledgement to my beautiful daughter, Khalif Dantzler, who is a nurse. Thank you, Khalif, for all of your hard work.
that was a message from
Thank
our
you.
Stovall Foundation Vice President, Pamela Stovall Hill. Okay, so she's part of the legacy. She and her brother Stephen, who has also been on this this event, who have been checked in on the Zoom, are the grandchildren of Dr. Leonard Stovall, and very, very stalwart in that legacy. And of course, Pam's daughter, Khalif, is the great granddaughter. And also, let's give a shout out to Zoe Danster, who's the great great granddaughter of Dr. Leonard
Yay.
Stovall. So it's a family affair. They are part of a great legacy. They have worked all their life to continue to venerate Stovall Foundation and Dr. Leonard Stovall. You know, 100 years ago, he was a lone voice. I mean, always remember that, ladies and gentlemen, that the great Latino activists, the great African-American activists, the great Asian American activists, the great Native American activists, 100 years ago, 120 years ago, there were voices in the wilderness. There was no real opportunity for them to be on the front line of helping to make change. So they had to figure it out. And in the case of Dr. Leonard Stovall, I mean, he graduated from Hollywood High School in about 1906. That's an amazing thought, everybody. And he was a medical doctor by the early teens of the 20th century. So the continuity and the sustainability of the Stovall Foundation should be acknowledged and recognized. And if you look at the link between the Outdoor Life and Health Association and the Stovall Foundation, we're talking about 85 years that this thought idea of having an organized opportunity, and what Dr. Stovall did, just you know, speaking casually, Dr. Stovall aligned all of the other significant African American entrepreneurs, scientists, people who were of a like mind. And that was really the brain trust, the foundation of how African Americans were able to be successful. And really, we are on the shoulders of great people like that. And Dr. Stovall, again, was in the forefront. So we're very, very proud. So is there anyone else who has any last comments before we go? Okay, so please don't forget to respond to what Fred said about looking at the question in the chat. And otherwise, David, again, great job. Khalif, great job. And we want to acknowledge this event actually was an outgrowth of the Stovall Events Committee. And the Events Committee consisted of Dr. Stephanie Powell, Adrienne Thompson, Renee Anderson, Dr. Marilyn Parker Brooks, and Alicia Sutton, along with Khalif and David and myself. So we're just very, very happy that you all tuned in and you gave us these great ideas. I mean, the chat was amazing, the things that you all were saying. So just really want to say that. So without further ado, if we're all ready to go, let the church say amen, and we will see you the next time. But please make sure you're on our mailing list, okay? We want to have, you know, we'd like to have 100 people next time. We'd like this to be something that you have a lot of value, okay? So take care, God bless, and we'll see you next time, okay? Bye-bye. Adios.
Have a great weekend,
Have a
everyone.
great evening.
Have a nice weekend. Thank you all for being here.
Yeah, really appreciate it. Okay, Fred. Okay.